Board certification is essentially a quality assurance process that the medical community has engaged in to ensure that doctors who advertise themselves being able to help patients have the appropriate training and experience to do the right surgeries and to get good outcomes. So it's a lengthy process of completing accredited residency training programs, of graduating from an accredited medical school, and from completing years of written examinations. And this all culminates in about a 48-hour period of in-person oral examinations and examinations of your surgeries and your outcomes. If after going through all of this, if a panel of superior and well-respected spine surgeons reviews your cases and votes that you have provided high quality of care, have demonstrated a pattern, at that point you can then become board certified. So it's a lengthy process, and the process is designed to create sort of a standard of care, a standard of high quality care.